Hello, I am Dr. Hussain Iqbal. I am an orthodontist and dentofacial orthopedist. I am a smile design specialist working with COSMODENT India, Frazer town, Bangalore. Now, the first dialogue between a doctor and a patient is a really critical one because that confirms or that leads to the best part of the treatment, that is the diagnosis. Based on a good diagnosis, one can provide good treatment. So for a successful treatment, an apt diagnosis is required because without that diagnosis, a good treatment cannot be provided. And for the diagnosis to be right, one has to listen. Now the minutest of details that the patient conveys to the doctor have to be recorded very keenly, very precisely, because in those details are hidden the secrets of a correct diagnosis. 80% of the communication usually is based on listening, and only 20% of the communication has to be talking. So what we consider that when a patient walks into our premises, we give more emphasis on the problems of the patient, what they have to say, and we give them all ears. For example, the nature of the pain that the patient describes, as in a stabbing kind of a pain, or a stinging pain, or throbbing pain, what kind of a pain that the patient is perceiving can be best described in the words of the patient themselves. It can be a slow, lingering pain, or it can be a sharp shooting pain. Now, all these descriptions of pain themselves can lead us to so many differential diagnoses, like it can be an irreversible pulpitis, or it can be a reversible condition of the pulp that can be treated. It can be an acute kind of a pain, or it can be a chronic type of a pain which is mild in nature. So all these can be derived out of what the patient has to say about the pain. Now, also we need to record the patient's dental history. That also comes with listening to the patient keenly. The patient may convey part of a dental history initially and may stop because they might not feel the need to go into the detail or depth of the dental history then. But as and as you keep hearing them out, they give you a lot of details and you form a perspective on the kind of dental history that the patient have had. It also makes the scenario, the clinical condition clear to you, and you can start visualizing as to how the condition would be in the patient's mouth even before starting a clinical evaluation. For example, if the patient says that they have bleeding gums, they say that they are 50 years old. They also say that this condition has been there for the past 3-4 years now. When you still ask them to tell them about their dental history, they might say that they have never been to a dentist before. They might say that they are diabetic. They might also say that the teeth are moving in their mouth. So as and as you give them time, there is so much that the patient tells them. When you ask about the medical history, they might say that they are taking 30 units of insulin. Big thing. All this, after hearing this out, the window of diagnosis or the window of differential diagnosis actually narrows down, and you lead to a more conclusive treatment plan formulation. Also, the questions that the doctor would ask the patient after listening them out will be more directed towards a particular diagnosis, as by then the doctor would have judged or understood what the problem of the patient is. Now, keeping aside the diagnostic aspect, listening also leads to a lot of psychological and emotional satisfaction to the patient. Ultimately, what does one want? They want themselves to be heard. People want that someone listens to their problems, someone listens to their needs, someone addresses to the story that they have to say. And believe me, if you listen to your patients, that will take you very long way with your patients. And the kind of confidence and the trust that you build with your patients, there is nothing that can beat that. So from this advice, if one piece of message that you would want to take away, that would be listen very keenly to your patients. Thank you.